Assalamualaikum and a very good morning to Dr. Haida. My name is Nur Farah Wahida and today I will explain about bleeding time. So what is bleeding time? Bleeding time is the time taken for a standard wound to stop bleeding. It assesses the primary phase of hemostasis, which involves the interaction between platelets and the blood vessel wall and subsequent formation of platelet plug. It used to detect a significant defect in platelets function. There are several methods to perform this test, such as the IB method and Duke method. The principle of this test is made on the volar surface of the forearm, earlobe, or fingertip. The time the incision bleeds is measured and it will be counted in minutes. The objective of this test is to determine bleeding time using IB's method and Duke's method.
For IV's method, the equipment and materials needed are number 1, stopwatch, number 2, sterile lancet, number 3, filter paper Whatman number 1, number 4, 70% alcohol, and number 5, sphygmomanometer. And the specimen needed for this method is capillary blood.
Procedures. First, place the sphygmomanometer cuff around the patient's upper arm just above the elbow. Inflate to 40 mm mercury and keep this pressure throughout the test. Clean the underside of the forearm with 70% alcohol and allow it to air dry. Ensure that the chosen area is devoid of any superficial veins or scar with approximately 3 fingers below the elbow. Puncture the skin approximately 1 mm deep using a sterile disposable lancet at 2 different spots with 1 cm distance. Start the stopwatch once the first puncture is done. Blot off the blood from each wound using the edge of the filter paper at 30-second interval without direct contact with the wound. Stop timing when all wounds have stopped bleeding where no blood stain is evident on the filter paper after a gentle touch. Lastly, record the time taken as bleeding time.
For the Duke's method, the equipment and materials needed are number 1, stopwatch, number 2, sterile lancet, number 3, filter paper Whatman number 1, and number 4, 70% alcohol. The specimen needed for Duke's method is also capillary blood.
So hi guys, my name is Nur Atika Mentiuzadi and we will continue the video with the procedure of Duke's method.
The first step is clean the tip of a finger with 70% alcohol and allow to air dry. Next is puncture the skin of the fingertip using the sterile lancet. Then start the stopwatch once the puncture is done. Blot off the blood from each wound using the edge of filter paper at 30-second interval without direct contact with the wound. Stop timing when no blood stain is evident on the filter paper after a gentle touch. Last is record the time taken as a bleeding time. As conclusion, counter drop starting from 0 second to no blood drop. We can see on this video the time taken of no blood drop is 5, which means 5 multiple 30 second is 150 second.
Hello, my name is Nur Adlina Alia binti Muhammad Supri. So now, let's answer some questions. The first question is, state variables unrelated to hemostasis that may influence bleeding time. The first one is medications taken by the person. Next, alcohol intoxication, vitamin C deficiency, elevated concentration of urea in the blood, pediatric and neonates, and lastly, loss of liver function. The second question is, Identify drugs that may cause prolongation of bleeding time. The drugs are non-steroidal anti-inflammatory drugs, including aspirin, tricyclic antidepressant, antipsychotics, theophylline, antibiotics such as penicillin, cephalosporins, and anticoagulant such as heparin, streptokinase. The last question is, describe the clinical conditions associated with abnormal result of a bleeding time. The possible clinical condition may be von Willebrand disease. Von Willebrand disease is a blood disorder in which the blood does not clot properly. Blood contains many proteins that help the body stop bleeding. One of these proteins is called von Willebrand factor. People with von Willebrand disease either have a low level of von Willebrand factor in their blood, or the von Willebrand factor protein does not work the way it should. The next condition may be thrombocytopenia. It is a condition in which a person has low blood platelet count. It may occur as a result of bone marrow disorder such as leukemia or an immune system problem. It can also be a side effect of taking certain medications. Disseminated intravascular coagulation also may be associated with the abnormal result. It is a serious disorder in which the proteins that control blood clotting become overreactive. As a result, blood clots may reduce blood flow and it will block the blood from reaching bodily organs. As the condition progresses, platelets and clotting factors will use up. When this happens, the person will begin to experience excessive bleeding. Last but not least is Glanzmann's thrombasthenia. Glanzmann's thrombasthenia is a bleeding disorder that is characterized by prolonged or spontaneous bleeding starting from birth. People with Glanzmann's thrombasthenia tend to bruise easily, have frequent nosebleeds, or also known as epistaxis, and may bleed from the gums. So that's all from our group. Thank you.